Hello and welcome to Ask Dr. Gupta. We are discussing cancers in our recent discussions. So far we have discussed the general symptoms and the broad outline of the cancer treatment. Now we shall start discussing organ by organ, organ system by organ system. We shall begin with an organ whose cancer is very common and has very good results, the breast. We shall be discussing how to approach a breast lump. Breast lump is among the commonest complaints in a doctor's clinic. They are also a very common reason for panic. This video will also be useful for young doctors who have just started their practice and they get puzzled about what all causes can cause breast lumps. Fortunately, the awareness about breast cancer is quite high. Ladies seek medical opinion early. This is one organ whose illnesses are amenable to self-examination and are easily accessible to examination by a clinician also. This ease of examination is one of the reasons for excellent results seen in cancer of this one particular organ. Before I start any discussion, I would like to emphasize that the information being shared here should not be used for self-diagnosis or self-treatment. No lady should be treating herself, or nobody who is not a doctor should be treating a breast lump because it can be dangerous. The purpose of this discussion is to make people aware about the situations other than cancer where a breast can have a lump. From our earlier videos on symptoms of breast cancer, we know that breast cancer starts as a lump. However, many of the lumps are non-cancerous. Still, for safety, we suggest every breast lump to be taken as cancer unless and until it has been proved that it is non-cancerous. Age is no guarantee against breast cancer. I have treated ladies in their late 20s also for this particular disease. Cancerous lumps are hard, they grow rapidly, and as I have emphasized again and again in our discussions, they are painless. Sometimes if they are located behind the nipple, then they can also give rise to inward pulling, that is retraction of the nipple. Young ladies have breast tissue which is relatively firm. I have seen sometimes very young girls, they are very apprehensive and they lift the entire breast thinking that this is a lump. It should be clearly understood that we call a lump a nodule when there is a definite discrete mass that can be palpable, separately can be felt, different from the surrounding normal breast tissue. Young girls sometimes before reaching the age of 20 get non-cancerous lumps in their breast which are called fibroadenomas. These fibroadenomas are non-cancerous, they do not spread to other parts of the body, but at the same time they will keep on growing at the place where they have originated. This can lead to their growth to enormous size and sometimes they almost replace the whole breast. In this situation, when we operate, then the shape of the organ can get distorted. Sometimes they become so problematic that the whole organ is to be removed even when this was not cancer. So it is advisable to seek early medical opinion and please do not run from surgery. I would suggest that these non-cancerous lumps also should be handled by a surgeon who is well versed with pathologies of breast, because even benign lesions, if not removed completely, if not removed properly, can come back. Sometimes there is more than one lump. This tiny lump can sometimes be missed and they grow later on. So please get yourself properly investigated and get yourself operated by an appropriate surgeon. One very common complaint in young and not so young is lump in armpit. It is sometimes what we call as tail of the breast, the extension of breast into the armpit. If there is a lump in the armpit which is soft, which can be compressed, and the best thing is if it is present on both the sides similarly, then you can relax that it is most probably not dangerous. Still, instead of assuming anything, it is better to get it examined by a doctor and reconfirm that it is totally harmless breast tail that you are looking at. Pus, fever, a lump, especially in a lady who is breastfeeding her child, is likely to be an abscess. These abscesses can today be managed many times without giving a cut by just repeated aspirations of pus. At the same time, there is one very aggressive cancer that looks similar. So whenever there are these symptoms, please discuss the doctor immediately. Immediate medical attention is crucial. Remember, cancer or no cancer, smaller the lump, less will be the tissue to be removed. This will translate into better cosmetic results. We should involve specialists from the beginning. particularly if we suspect cancer. Sometimes I have seen an incorrectly placed cut to remove a doubtful breast lump forces us to remove the whole breast even for a small tumor. So the conclusion is that if you have a definite breast lump, please meet a doctor. If this is not cancer, you will get away with a small procedure, and if unfortunately it is cancer, then early stage will ensure the best outcome. With all this information, I will wish you all a very happy and a very healthy life. Those who are undergoing treatment, I wish them a very speedy recovery. Thank you.